good. I like that, huh? And then they'll stand up and they'll do that where they're shaking out any excess, any excess medications or an ear wash. They'll get it all cleaned out. I know. She says there's no carpet or grass, I can't rub it. But typically owners will have to do medications if it's an infection for 2 weeks, 10 to 14 days, and it's okay, girl. So we usually recommend doing that outside so that when they shake their ears, they're not getting it all over your house. Okay, any questions with that? Okay. Another one that I saw on there, which I can have all of y'all do because we're not going to inject the dogs, is filling a syringe. So this, all you have to do is fill it. Is that correct? Right?
Probably, yeah.
Okay. So, so I'll just talk you through it, and then I'll pass this around, and y'all can use it and do it yourself. So any injection that you give, you're going to change the needle out every single time you use it. Even when we pull up a vaccine or pull up a medication to give it, we'll pull it up, we'll take this needle off, and we'll change it out and put a new needle on. Anytime you're injecting it into a port of any kind, it's dulling the needle, so it's not as sharp as it would be if you just gave it fresh. And so for their sake, we like to have a fresh new needle so that it's easier to get everything and faster to get everything in and out. So when you're pulling up filling up a syringe, the plunger, the top of the plunger is the amount that you are filling, not the bottom. Check. So you're gonna put it in, this is the port. Anytime you do a port, you're gonna clean it with alcohol. Put the needle in and you're gonna pull it back. And then there's lots of air bubbles in there. So you're gonna either tap it while it's in or tap it while it's out, and then go back up with your, or push it back in so that you have no air bubbles in the needle hub or the syringe whatsoever, because you don't want to inject air into anything.